Destiny. My name's May. I'll be taking care of you today. We're going to do a H2T assessment. Just to get us started, can you tell me your name and your date of birth?
Destiny Olafsson, December 2nd.
Okay. And what do you prefer to be called?
Destiny.
Destiny? Okay. All right. Well, again, my name is May, and I'm going to be taking care of you. I'm going to go ahead and explain everything that I'm doing as I do it. If you have any questions, don't hesitate to let me know or stop me at any time. What brings you into the clinic today?
Just a health visit.
Just a well visit? Okay, perfect. Okay, let me get this dried up and then we'll get started. Feeling well today? Did you need to use the restroom before we get started?
No, they had me go before.
Okay, so they probably went ahead and did a urine test on you. Okay, did they talk to you about your vital signs?
No.
Okay, I have that here, and I'll also give you a card on the way out. You can keep track of it if you want. Looks like your blood pressure was 120/64. You are 5'8", 157 pounds. Your oxygen saturation was 99%. That's just the amount of oxygen that is going through your body in your blood. That's the little thing that they put on your finger. Okay? And then your pulse was 87, respirations were 20, and your temperature was 97.7.
Okay.
All right? And here's that little card that I was talking about. Okay. All right. Well, the first thing I'm going to do is I'm going to start at your head. I'm going to look for anything that's out of the ordinary. You haven't had any itching or any bruising, any slips, trips, or falls lately?
No.
Okay. Well, everything does look fine. The next thing that I'm going to do, and I'm looking to make sure your skin is nice and there are no obvious bruises, cuts, anything like that. Next thing I'm going to do is have you look up. I'm going to look in your eyes. Okay, can you watch the tip of my finger? And what I'm assessing for right now is that your eyes can adjust to the amount of light in the room, and then also that they can adjust to the different circumstances when you're looking at things close up and far away. All right? Okay. The next thing I'm going to do is I'm going to look in your ears and make sure that I don't see any drainage or anything like that, which your ears look fine. Very good. I'm going to go ahead and I did want to ask, there's no problems with me touching any part of your body, religious or anything like that? Okay. All right. I'm going to touch your sinuses. I'm going to press. Do you feel any pain when I do that?
No.
Okay. All right. If you could tilt your head up, I'm going to look up your nose. I know it is allergy season. This side's a little red. Have you been?
Yeah.
Okay. And could you open your mouth and say, ah? Okay, that looks good. Your teeth look like they're in wonderful condition. Oh yes, everything, mucous membranes nice and pink and moist, and that's how we like to see things. It means that there's no drying out, anything like that. So I'm going to touch your neck here, feeling your lymph nodes. And usually if there's an infection that we don't see or anything, we'll notice that those are swollen. But everything appears to be really good. So, and then also sometimes during this assessment, I'll have you lay down. Sometimes I'll sit up. It just depends on what we're looking for at the time. Okay. So the next thing that I would like to do is I'd like to listen to your heart. Okay. My stethoscope. The first thing we listen to is at the bottom. We call it the apex of the heart. And then we'll go around to the pulmonic valve, and then we'll come around to the top, and we'll hit the aortic valve and the pulmonic valve at the top.
Okay.
Okay, does that sound good? And I will be putting my stethoscope on your chin just to let you know. So I may reach into your shirt. And we're going to listen to this. Each of the places we'll listen for a full minute. Okay. Your heart sounds are wonderful, nice, and strong. Okay, and that's exactly what we want to see. Next thing I think I'm going to do is, I'll go ahead and take this from you. I'm going to get you to do some deep, deep breaths for me.
Okay.
And I'm going to listen for your lung sounds. Make sure I don't hear any wheezing or rattling or any really wet secretions in there. And so as we're doing this, I'm going to have you take some nice deep breaths. If you get dizzy or lightheaded, please let me know, and then we can take a rest and then proceed. Okay? Sound good?
Mm-hmm.
All right. Nice deep breath. Again. Doing okay?
Mm-hmm.
Okay. Okay. All right. So far, everything is sounding nice and clear. I don't hear any signs of wheezing. So you haven't been coughing probably at all. Okay. Next thing I'm going to do is I'm going to listen on your right side for your breath sounds as well. There's a small lobe on the right side that we can't hear very well unless we listen on the side.
Okay.
Okay? So, yep. Thank you. Again, deep breath. Very good. Okay. Again, that sounds great. And what I'm going to get you to do is I can get you to twist around a little bit so I can reach your back. Can you twist this way for me?
Oh,
sure. Okay. Ready?
Mm-hmm.
Okay. Nice deep breath. Okay. Again. Okay, everything sounds great. No, I did not hear a single crackle or rattle or anything like that, and that is very good news.
Okay.
So next thing I'm going to do is I'm just looking at your skin here, making sure it's nice and warm. It's not you're not clammy or moist or any way at all. So that's good. I'm looking to make sure there's no swelling or what we call edema. I'm going to also check what we call your capillary refill. So you can see your thumbnail's nice and pink. When I squeeze it, it turns white, but the pink comes right back, and that's exactly what we want to see. That means you have great circulation going on, Destiny. Okay. Next thing, if I could get you to cross your arms like this and give me a squeeze evenly, very good. Even on both sides, perfect. Okay. So from there, I think I'll go ahead and start, and we're going to work our way down. So I'm going to listen to your vowel sounds first, and then I'm going to, kind of touch and make sure that I don't feel anything out of the ordinary. So if I could get you to lay back on the exam table, please. Okay, and I'm going to lift your gown up a little bit so I can get to everything that I need to get to. Okay, and put my stethoscope on and take a listen. Now, what we're listening here for is how many sounds we hear in your belly, basically, to make sure that everything in your digestive tract is moving around the way that it should be. Now, when was your last bowel movement?
Yesterday.
Okay, and has everything been kind of normal for you? You're normal? Okay, yeah. That's great, because we want to make sure that it's normal for you, not necessarily what's normal for me or the doctor. So,
okay.
As long as you don't have anything that's concerning you,
no.
blood, anything like that, or
no.
painful bowel movements, then everything is probably just fine. Okay, so I'm gonna start by listening in the right lower. I'm gonna move up and around, kind of like a clock.
Okay.
All righty? Okay, here we go. And we'll listen to this until we hear either between 5 and 30 sounds, and then go on, or if the sounds are absent, we'll listen for longer to get those sounds. If not, then we'll go from there, okay?
Mm-hmm.
Okay. How long ago did you eat breakfast?
It's been a little bit.
Well, but that's good because it didn't take any time at all to hear those sounds. Everything is very, very active. That's why it went rather quickly. Everything's just clicking and moving along the way it should be, okay? All right, so next thing I'm going to do is I'm going to go ahead and take my hands. I'm going to kind of feel around your belly, make sure that everything is nice and soft, that there's nothing hard that shouldn't be. And this would be an indication of if we had a swollen organ or something like that. But I don't feel anything. Everything feels terrific, okay? All right, I'm going to go ahead and put your gown down. The next thing, I did forget, but if you could show me that your elbows work well, your wrists, shoulders. Okay, I apologize. I did forget. I usually have people do that when they're sitting up.
That's okay.
But better late than never, right?
Mhm.
Okay, so can we test the same thing on your legs? No pain or anything like that? Ankles move well? Perfect. I'll try this one. Okay. All right. Would you mind if I took your socks off to take a look at your feet? No? Okay. All right. The next thing that we're kind of looking for, just like I looked for on your hands, we're making sure that your skin is nice and warm to the touch, which is an indication if they were cold, we'd be concerned about your circulation. All right. So I'm going to, cute paint job. I'm going to steal your socks and we're going to check out your legs and make sure that everything is okay down there. What? Really nice. Okay, again, I'm feeling everything's fine. You don't have any problems with movement of your legs, no pain, anything like that? Okay, the first thing that I'm going to have to do, I'm going to step around here. So I need you to put your leg, there you go. Now press like a gas pedal. Okay, good. Now try to pull away from me. All right, okay. So I'm also going to touch down here, and I'm feeling for the pulses in your feet, and they should be equal, which they are. Nice and strong, equal pulses. Okay, again, we're going to check for that capillary refill. A little more difficult with polish on, but we can notice by the skin right here whether we're getting that refill, because it's going to go red, and the color comes right back the way it should. Okay, all right. Everything looks fine. Okay, so do you have any questions for me, Destiny? Nope. All right, I'll let you sit up. And you can put your socks back on if you would like. And I'm going to make some notes in your chart that you'll have those notes available to pick up. And then the doctor should be in to see you soon. Okay. Did you have any questions for me?
No.
Okay, well, Destiny, it was definitely great to meet you. I hope to see you again in the future for well visits, and I do appreciate you coming in. We're going to do the best we can to keep you nice and healthy so we don't have to see you when you're sick.
Okay, thank you.
You're welcome. And if you need me, I'll be at the nurse's station. It's right across from the back room.
Okay.
All right, have a good day.
You too.
Bye.